Well, good afternoon, everybody, and welcome to today's RCSLT webinar, Inclusive Communication Nation. My name's Derek Munn. I'm the Director of Policy and Public Affairs here at the Royal College. I'm delighted to be joined by our Head of Scotland Office, Kim Hartley-Keane, our Deputy Chair, Della Money, and Amanda Bennett, who's an independent SLT and a leading expert in this field. The webinar is 45 minutes long. We will take some questions at the end, although I can tell you right now we won't be able to get through all of them, and we'll answer some others online later. If you've not done this before, hopefully you'll be able to see on your screen a Q&A button, which will enable you to submit a question to us. We'll deal with it during the session if we can, or as I say, afterwards if not. If you're experiencing any technical difficulties, use the chat button and my colleague Kaylee will deal with your connection difficulties if we can. Just to let you know that the webinar is being recorded and will go online with all of the slides, but I'm afraid that won't now be until after Christmas. You'll also have an opportunity to feedback at the end. And if you're managing to multitask and tweet as well as being on the webinar, hashtags are RCSLT webinar and hashtag inclusive communication. We hope that by the end of the session, you will have some strategies for embedding and promoting inclusive communication through hearing examples, feel a sense of ownership and excitement about inclusive communication, and know a bit more about both RCSLT's plans in this area and also the key points of the inclusive communication position paper developed by RCSLT. So, to set the scene and kick us off, I'm delighted to hand over to RCSLT's Head of Scotland Office, Kim Hartley-Keane.
Good afternoon, everyone. It's fantastic to be here. As Derek said, I'm Kim Hartley-Keane. I'm the head of the Royal College of Speech and Language Therapists Scotland office, and it's my job in Scotland to influence the Scottish Parliament and Scottish Government on behalf of the profession and people that access speech and language therapy. So it's great to see that there's so many people joining in this webinar about inclusive communication, a topic of passion for me personally, but also an area we've done a lot of policy work on over the years. So just to kick us off, I'm just going to give you a definition of inclusive communication, and this is set out in our position paper. Inclusive communication is, as it says on the tin, it's an approach to communication which enables as many people as possible to be included in that communication. So it's about ways of communicating. So inclusive communication encourages and enables people to use the ways of understanding and expressing themselves which they find easiest. So if someone finds it easy to understand through use of symbols, pictures, gesture, or simple language, that's what other people should use to enable them to understand. And similarly, if they use those means to express themselves, so others should recognise and respond to the means that they're using to express themselves as they might to any other form of communication. So inclusive communication organisations encourage and enable people to use those ways of understanding and expressing themselves which their service users find easiest. But it's more than just the knowledge, the skills, and employing those strategies, using knowledge and skills of the person and strategies to enable communication. It's also largely about attitude. Inclusive communication requires an attitude where people recognise that effective communication is everyone's responsibility. It requires an awareness of the impact of living with a communication disadvantage and how that can be resolved, and others taking responsibility for reducing that disadvantage. There's 3 levels of practice for speech and language therapists, and I'm not going to go into these in any detail because Della is going to talk about those as we move forward. Again, spelt out in the position paper the role of speech and language therapists at these 3 levels of the individual, the environment, or at the organisational level, and then at that much wider community national level. So why are we doing all this work on inclusive communication? Well, there's several reasons. First of all, it's the right thing to do. No one should be excluded from society, from community. It's the college mission. Our mission is to ensure better lives for people with communication and swallowing needs, and we believe that communication equality will deliver better health, well-being and life outcomes for individuals, their families, communities and nations. SLTs have a deep and broad knowledge of human-to-human communication. It's what we're about. We have the skills and experience of identifying and resolving communication difficulties, and doing work on inclusive communication at that environmental and community level positions speech and language therapists as being useful and relevant to those policy objectives of public health, prevention, preventative care, human rights-based approaches, person-centred public services. It's also the law. Human rights legislation and equality law implies that we should be inclusive in our communication. It's policy, as I said, words like person-centred, asset-based, co-produced service planning, self-management, informed choice, all require effective and equal communication between service user and service provider. Of course, the nation's profile is communication profile is changing as there's more people living with long-term conditions with associated speech, language and communication disabilities. So inclusive communication becomes a much bigger imperative for the services providing for those people. And it probably, and I say probably because we need the evidence to back up this statement, it probably saves money and time for individuals, community in the country. And a good example, an appointment where someone hasn't understood what the GP said to them is a wasted appointment because they'll only come back sicker the next time, having not followed the advice. So we could save money if we got the message over right time, first time, every time. So what's college strategy? Well, our ultimate outcome is the fantastic idea of communication equality, or equal communication opportunities for everyone, all the time, everywhere. We want to see inclusive communication widespread, mainstreamed, accepted, and indeed embraced by everyone. And it's not just so a big inspirational goal, and it's not just an inspirational vision that we have. Here's a couple of quotes that I gathered from colleagues and acquaintances in Scotland. So Helen Gowland, a lady who is aphasic, said an inclusive communication world would feel like the sport was a natural thing. And our colleague, and then Catherine Townsend, who's head of customer and client access at Barclays Bank, talks about products and service. It would be different for now because products and service design from day one would consider customers with different needs and make sure that access was ensured. So a fantastic goal for us all to aim for. So how are we going to get there? Well, there's several interim outcomes that we've identified on the way to that ultimate outcome. And I'm absolutely delighted to say that it mirrors the challenges and solutions that many of you sent in as part of your registration. And thank you very, very much for that. It was a fantastic piece of information given by you. So what the interim outcomes are a shared inspirational vision. We want everyone to be on board with this idea. Wouldn't it be great to have communication equality? We need widespread understanding and awareness of what that would mean, of why we need it, of the impacts of communication disadvantage. We need strategic ownership and leadership of change, not just by speech and language therapists, but by all those stakeholders that we would like to change in terms of their communication behaviours as organisations and as nations. And in order to help them to make the right change, we have to give them clear instructions, a national inclusive communication quality standard. What is it we want them to be doing, or works really? And we need a joined up strategy, some investment resources to implement that regulation or that inclusive communication standard or law. So what have we done so far in terms of this strategy? Well, we've been building partnerships across the UK, particularly in England, Scotland, and indeed across the world as part of the International Communication Project, getting everybody involved in that shared inspirational vision. We've produced a position paper, and there's lots and lots of things in that position paper listed there on the slide, not least current terminology, and a description of all the roles of speech and language therapists, as I've talked about before. We've also produced a college web page on inclusive communication, and that's delivering to that interim outcome of widespread understanding and awareness and strategic ownership and leadership of change by speech and language therapists in particular. And there are great examples on that website, for example, from Solent, from Essex and from other areas, and we'd encourage you to keep giving us examples so we can keep putting them up on the website. We also, of course, are running the event today. This webinar is about delivering to that interim outcome of strategic ownership and leadership by you, speech and language the speech and language therapists, and I know there are others on the webinar, so that's great. And we're also doing a lot of work around the communication access symbol in the UK. We're now in the second phase of the consultation. The consultation that's out at the moment, which I'd urge you all to participate in, is now looking at these two symbols and is also presenting the communication access standard that will go behind that symbol, and is asking people to comment on those. So I would encourage you to take part. And finally, we're doing a lot of stuff in-house. What we're trying to do is be the change that we want others to be. Be the change we want to see. We have to lead by example. And we also want to learn, what's it like as an organisation? How much does it cost? Who needs to be involved in terms of developing an inclusive communication organisation? So that we can present that very concrete information to those that we want to change. So the sorts of things we're doing is, as I used in my opening slide, using that photographs and symbols. We've done staff training. It's in our business cards, email signatures, door signs, that kind of thing. Perhaps perhaps in your department, you might be doing the same or want to copy us. Anyway, there's a little list of more information there, and I now hand you back to, I'll hand you on to Amanda.
Thank you, Kim. Good afternoon, everybody. My name is Amanda Bennett, and I'm an independent speech and language therapist and proud to call myself an inclusive communication campaigner. Today, I'm going to talk about a national initiative to promote inclusive communication that I've been involved in here in Scotland, and outlining the approach we took. Our learning from this, I hope, will be useful in looking at how we take this issue forward generally. I'm a passionate believer in communication as a political issue, and it was the reason I actually became a speech and language therapist, going back to university for a second time later in life. And slightly to my surprise, after qualifying, I found myself working in hospitals primarily on swallowing issues. Though really important, it was not really my bag. So I took the opportunity in 2007 to move to Scotland to work on the Civic Participation Network project, which was all about promoting inclusive communication. At the time, it was just a one-year project, but I've never looked back, and I'm still based in Scotland. The Civic Participation Network project was a national initiative funded by the Scottish Government. Its overall aim was to promote active participation of people with communication support needs of all sorts in civic life in Scotland, and our primary method was to promote inclusive communication. It was a small project with big ambitions, and I was lucky enough to work on this full time, and I do recognise that few SLTs have the luxury of doing this. Over 4 years, we had a series of outputs. We had, first of all, the Talk for Scotland Toolkit, an online resource aimed directly at service providers. And amongst the other information included in that, we had 6 communication support principles that we wanted everybody to follow. Principle 1, recognise that every community or group may include people with communication support needs. Secondly, find out what support is required. Thirdly, match the way you communicate with the way people understand. Principle 4, respond sensitively to all the ways an individual uses to express themselves. Principle 5, give people the opportunity to communicate to the best of their abilities. And very important, Principle 6, keep trying. We promoted these principles at all times, and they were aimed at everyone and all services, private and public. So Principle 1 was particularly important as we were making them applicable at an organisational and community level as well as an individual level. In addition to the toolkit, we had awareness raising and training linked to the key messages. We did a series of small case studies around the costs and benefits of implementation of inclusive communication. And we set up an inclusive communication trainers group and piloted some communication accessible training. As I say, this was a small project with big ambitions, and our approach was to do everything to maximise the impact. And I could sum up our approach in 4 words: co-produced, mainstream, opportunistic, and evidenced. In terms of co-produced, co-production is an often misused word, but I believe that we successfully worked in partnership with people with communication support needs at all times, so they helped us develop all the outputs, and they were included as co-trainers in any awareness raising or training that we did. We worked with SLTs in Scotland. For example, we ran a study day to help develop the 6 principles, and we worked importantly with service providers from the very beginning who were likely to use the resources we were producing. So, for example, we had an advisory group, the membership of which included reps from health, education, third sector, etc. We ran all our meetings and events using basic inclusive communication principles to illustrate our key messages. I just wanted to include this slide. It's a slide from one of our colleagues, Robert, who has significant dysarthria. He would use this when we were presenting together, whatever the audience, to highlight the importance of really listening to the experts, that is, people with communication support needs. So to use Robert's expression, it was straight from the horse's mouth. The second word that I would use in terms of the approach we took was mainstream. We tried to take it away from special pleading, put the emphasis on inclusive communication as a human right and the positive benefits to service providers of adopting this approach. We highlighted that it was an issue for everyone and relevant to all forms of communication, so people should be following basic good practice in terms of inclusive communication at all times and not see it as an add-on. We built partnerships wider than health and social care. For example, we worked with Citizens Advice Scotland, and we worked with Scottish Parliament researchers and Parliament staff to try to raise awareness of the whole issue. We also tried to influence existing activities. So we identified organisations and trainers who were already doing community development and participation training and set up pilots in making their training more accessible using inclusive communication principles throughout. So this enabled us to work with organisations such as Engender, which is a key national feminist organisation in Scotland. We also supported individuals and organisations seeking change. So basically, both sides were getting something out of it. The third word I would use is opportunistic. We had a project plan, but we took any opportunity that presented itself to promote inclusive communication. And one practical resource, which you'll see up on screen, that we used a lot was a co-produced set of ground rules. This seems a small thing, but it made a lot of difference to all the people with communication support needs participating in anything we were doing. And it also meant by using these ground rules at any meeting, we could highlight the issue of inclusive communication, whatever the focus of the meeting itself. The fourth word I used was evidenced. We did, in a small way, gather evidence in terms of the benefits and costs of implementing inclusive communication. And this again enabled us to develop relationships with a wide range of people. For example, Young Scot, which is a major organisation working with young people in Scotland. What were the impacts of what we did? We did evaluate everything as we went along, and we got very positive feedback and some commitments to change. So there was some commitment to change at an individual and organisational level. And the Scottish Government, as a result of the success of the Civic Participation Network project, did put further project funding into work. They've taken a slightly different approach than the one we took. In terms of longer term impacts, as always, we were a short-term project and had little capacity to do longer-term impact assessment. But inclusive communication is a term now used regularly in Scotland, including by policymakers. However, it's not always understood and not always implemented. What do I see as the challenges now? Inclusive communication is still seen as an add-on. It's not necessarily embedded, and there is some lack of strategic leadership. There is inconsistency at an individual organisation and community level, and there still can be an emphasis on accessible information, not two-way communication. And there can be some confusion between the concept of clear language and dumbing down, which people sometimes see is what we mean by clear language. And there's a lack of concrete evidence and methods for evaluating impact. So in summary, I would continue to recommend the approach that we took: co-produced, mainstream, opportunistic, and evidenced. And as I said at the beginning, I appreciate that I was lucky enough to work on a project, the aim of which was to promote inclusive communication. But as an independent speech and language therapist, I continue to take any opportunity to promote it, whatever I am working on and with whatever organisation. So, for example, whether I'm working at Queen Margaret University or NHS Education for Scotland, I raise the issue of inclusive communication with my colleagues at all times. I'm also lucky enough to be working together with Kim and RCSLT to promote inclusive communication in Scotland, and we're taking an opportunistic approach to it. At the moment, we're working on influencing the Scottish Health Council survey, the Social Security Bill, and the Health Literacy Action Plan. And another thing that we happen to be able to do, as a result of just responding to an invitation which was sent through the email around the annual Scottish Government Household Survey, we've been able to influence the wording of the questions, accompanying information, and discuss inclusive communication with MORI, a major survey organisation. I'd like to finish off with a quote from the horse's mouth, and the reason why I, and I'm sure many of you, are so passionate about inclusive communication. This is a quote from a young man, Connor, who's been involved with us for a number of years on promoting inclusive communication. He's faced major barriers both at school and in the world of work. And to use his words, "I know how difficult it is living with communication support needs and how much still needs to be done to break down barriers. If Scotland was an inclusive communication nation, it would make life and work more inclusive and less isolating for people like me." I believe, as a speech and language therapist, that together with people with communication support needs, we can change the world. Thank you very much for listening to me. And I'm now going to pass over to my colleague, Della.
Thank you, Amanda and Kim. Good afternoon. So my name's Della Money, and alongside being the Deputy Chair for RCSLT, my day job is a consultant speech and language therapist in Nottinghamshire Healthcare NHS Trust. And this afternoon, Kim and Amanda have introduced the idea of inclusive communication at that wider, universal and community level. And I'm going to present the individual case for inclusive communication. So the individual case is that everyone needs safe and effective services across health, social care, education and employment. And that includes people with speech, language and communication needs. And this is really, really important because people with speech, language and communication needs are at risk. For them, poor communication is a risk of not being able to access health, education and housing, everyday things that we take for granted. But it's also a risk that if they're involved in services and right through to criminal justice systems and prisons, that if their communication needs are not addressed, they are at risk of not getting the same services and the same access that everybody else has a right to. And this isn't just one specialism or client group. This is everyone, everywhere. Children and young people, adults, those with developmental and those with acquired communication needs. And none of this is new. So in the Royal College position paper that Kim referred to, we represented this model that was initiated 15 years ago. So when we look at this, the centre of this is all around the individual. It's looking at the means, reasons and opportunities, or the how, why and the where and when and with whom people communicate. It's also looking at what makes up real world understanding. So real world understanding is together the impact of understanding words, understanding situations, which leads to your actual functional ability to understand. And we have to do all of this in the context of looking at the individual, but also the context of their environment and their community. So when we talk about the environment, we're talking about the services and the buildings that they may, as individuals, interact with. This may include clear language from service providers. It may include signage, face-to-face print. It may include how we communicate with that person on an individual basis. When we're looking at the community or the population level, that's the outside level, we're talking about inclusive communication as good practice being implemented everywhere by every service in every community as standard. So although this isn't new, it's still not easy. And we do have a few mandates now to hang off the importance of inclusive communication. But unless we can improve inclusive communication, it will still remain a risk factor for individuals. And these are just some of the risks that people with speech, language and communication needs face on a daily basis. So whether they can make choices, form relationships, how vulnerable or isolated they are because of less opportunities for education and work, how they access healthcare. If you can't express how you're feeling, you can't express your health needs, you might be misunderstood. This might lead to diagnostic overshadowing. You may have limited access to education, or it may be that you're in a prison context and you've got a verbally mediated program that you need to complete, but you can't access it because of your communication needs. All of these impact on your emotional and mental well-being, which can create more challenging behaviour, placement breakdowns, reliance on restrictive approaches, and non-compliance with legislations. And others constantly overestimate your ability. And we know this as SLTs. We know that working with individuals with who have inclusive communication needs, that unless we can address that, there are high levels of risk. We know that we need to look at reducing risk, developing inclusive relationships, and building the capacity and capability. So what is it that we're actually doing then with individuals to achieve this? This model of theory of change is just one example of theory of change models that are being introduced throughout RCSLT. This one is based on the 5 good communication standards, which were developed opportunistically following the 2013 Winterbourne View scandal, which was on Panorama. So the interim outcomes, they're the middle column. These are the things that we're aiming for. So we're aiming for everyone to be able to have information that tells you how best to communicate with them. We're aiming for people to be helped to be involved in decisions about their care and support. We're aiming for others to be good at supporting someone with communication needs. And we're aiming for people with communication needs to have lots of chances to communicate and to be helped and to understand and communicate about their health. And if all those interim outcomes were in place, then the ultimate outcomes listed on the other side are about being respected, safe, making choices, having a place of their own, being active, having fulfilling relationships, and being supported to access services which are reasonably adjusted to meet needs would all be in place. So Kim talked about interim outcomes at a universal and community level, whereby inclusive communication is widespread and mainstream. But these are the ultimate outcomes for the individual. And as SLTs, we work towards these, whether it's screening, assessing and formulating individuals' communication needs, their environment's communication needs and the support required, through to whether it's providing training, advice, mentoring, supervision of others, or whether it's about facilitating reasons and opportunities, or involving people in projects, or participating in evaluation and research. These are all the activities that we do to try and achieve those interim outcomes, aiming for that ultimate outcome for a person with inclusive communication needs. So thinking about that, I thought I would tell you about John. So John attended mainstream schools in the 80s. His family were very pro-integration and inclusion, and speaking was seen as the priority because speaking was perceived as normal, and the speaking was perceived as the thing that you needed to do to be accepted and belong within a mainstream context. However, John had really significant language disorder on top of his learning disabilities. He had largely unintelligible, unique system of single words, signs, noises, objects and photos, and his comprehension was very limited. In his early years, and right the way through to further education, everyone worked towards John developing his communication so that he could be included. However, as the years went on, he became more depressed, isolated, his behaviour deteriorated, and he started to refuse things. And these all became major risks for him. And people realised that a different tact was needed. The pressure needed to be taken off John to change, and the pressure needed to be on the environments that support him and the communication partners to support him to make reasonable, necessary adjustments. Basically, that's the change of attitude that Kim was referring to. So this is what was worked on, and I'm very pleased to say that everyone understood that the role of inclusive communication to keep him safe, living at home and in the community. And the importance of that is that John is able to say, like many other individuals, that whatever communication works best for him is used and valued. That people communicate effectively with him because of their underpinning knowledge, skills and attitude. People listen, take time to support his communication. He gets the professional support he needs, including the communication tools and policies. But it isn't just John. It's everyone, everywhere. The seldom heard individuals with speech, language and communication needs participated in a project in Nottinghamshire Healthcare. And they told us about the reasonable or necessary adjustments they need for inclusive communication. And just to give you a little answer, somebody told us, give me more time, I will answer. Jeff said, listen a hell of a lot more, don't interrupt me. And Rachel said, don't pity me or finish off my sentences. So the challenge for you is, what are you going to be up to? We need to win hearts and minds to get commitment to inclusive communication rather than compliance. These are some of the ideas that we've come up with that might be things that you could do. But as Kim said right at the beginning, what you need to do is be the change that you want others to see. Thank you.
Thank you very much. Thank you very much to everybody. We'll take some questions and answers now in the time we have remaining to us. First of all, I'd just like to clear up a terminological thing, which several people just asked for clarification of inclusive communication versus total communication. Are they different? Are they the same? What does speech and language therapists implementing these approaches need to know? Kim, do you want to pick that one up?
Yeah, thank you very much. Well, it was a common question during the development of the position paper, and we consulted members on terminology. There was a whole lot of variety of terminology used: accessible information, total communication, inclusive communication, but there was also not just a variety of terminology, but a variety of definitions. And of course, when we're trying to promote a concept and promote a consistency, it's not helpful to have all that variety, and both within or without the speech and outside the speech and language therapy community. So there was a consensus got to through, and the Board of Trustees chose or through that consensus, the preferred term is inclusive communication. There is an overlap with total communication, and it's all described what that overlap is in the position paper. But essentially, total communication is the focus on at the individual level. It's about bespoke working, although you may argue with that. And then at the inclusive communication definition is more about that universal environmental approach. But there's a huge amount of overlap between total communication and inclusive communication. But essentially, settling on inclusive communication is about trying to have a consensus on at a single term that's understood by a broader population than might understand total communication. I hope that helps.
Thank you very much, Kim. Could I turn now maybe to Amanda to deal with a bunch of questions asking about examples of where inclusive communication has worked in practice, but in particular in community settings or working with communities. Is there anything you could say about that?
Thank you, Derek. Start off by saying the great thing about this webinar is when you registered, you told us what you're doing, and there are some really good examples there, which we definitely need to share. I mean, we have a lot of examples on the present IC website pages, but we do need to make sure that if there's anything missing that we do share that, because that's really the only way we're going to learn. I mean, at an individual level, we've obviously got lots of examples of how inclusive communication works, and Della highlighted the positive impacts for one service user, John. And there's also examples of a knock-on effect of working at an individual level to a wider organisation. For example, training staff in an organisation such as a prison to benefit one individual can build staff capacity to recognise others with communication support needs and find ways of better supporting them. At an organisational level, again, the inclusive communication position paper and the IC website pages do highlight examples of implementation across organisations. They're mainly closed communities and for specific groups within that community. For example, there's some examples of positive implementation across homes and day centres, an increasing number of examples of promotion of inclusive communication across whole schools. But most of them are about impact at present, where SLTs have a definite role and a presence already. So I suppose what we need to be thinking about is how we influence other organisations which are key to people's lives. I just use one example of Barclays Bank, which has an inclusive customer service approach, and it might be useful for people if they looked that up on Barclays Bank website. And our question might be to ourselves, how can we influence others in the same way? In terms of, I mean, there are less examples of implementation of inclusive communication at a community level, and I suppose that's what this whole webinar is about, really, how we move through the individual, organisational and community. And for me, it goes back to principle one and getting everybody to recognise that all groups and communities will have people with communication support needs, and to be using inclusive communication as their default setting, and thinking about it from the very beginning to the very end of any interaction that they're having with service users.
Thanks, Amanda. And just very briefly, we have had questions too around supporting teachers and anything particular to the education context. Is there anything particular you'd add on that?
There are some very, very good examples, as I say, of taking a whole school approach. There's the Stokes Speaks Out. There's the case study around collaborative working in Pembrokeshire, and so there's a number of, and there's a couple of case studies on the inclusive communication resource section around creating a communication environment to support daily transitions and that sort of thing. So quite a lot of examples on the website.
That's great. Thank you. Turning back to Kim again, your slide on the iceberg where the attitude was below the water and unknown to others inspired one of our participants to ask about how we tackle that attitude bit, if training doesn't seem to get to the root of it in all settings.
Thank you. Yeah, attitude's a bit more nebulous, isn't it, than knowledge and skills. But attitude is informed, of course, by knowledge and skills, but it's also informed by people's feelings, their sensitivities, the culture in which they're working, and also by the heroes, if you like, who are within that culture, and the rewards they think they're going to get for doing a particular thing. And I'm aware in projects that I've done around inclusive communication, introducing inclusive communication across primary care services in Edinburgh many years ago, it was identifying exactly some of those barriers and sort of why were people not doing what, taking on my sage advice about what they should be doing in GP practices. And I sort of touched on those underpinning aspects of attitude. One of them seemed to be just a fear. This was too big. It was going to be too difficult for them. And so there's something there about step change, but also people understanding that they don't need to do everything all at once, but that they will be supported within a culture which is going to encourage and enable them to take on inclusive communication practice. And that's why it's so important. There's ownership and leadership, and certainly that came through in the survey results. People were saying they just can't get the leaders to buy into doing inclusive communication. So if you've been on a training workshop but your boss says do that next week, it's not important, it doesn't happen, of course. The other thing is I also think that in terms of that, people's feelings, their sensitivities, so many of the people that we work with, their professional self-esteem, their professional identities based on them thinking of themselves as good communicators. And I think as soon as we start talking about inclusive communication, there may be some who are sensitive to the fact that they might read criticism in that everything they've done in the past is bad or not very good. We need to make sure that we're building on what people are doing well and giving people positive feedback for doing the right things at the same time as saying how can we enhance and enable you to be more effective as professionals, and putting it in that context. I think there's just to the other things that address that attitude is getting people into why are you doing this, what's the value in it, what's the reward in it. And Amanda talked about expressing the positive benefits for them as services, but I think they need to, a bit of experiential learning, sort of what's it like to live with a communication disadvantage. And there's obviously lots of activities we can do that last 5 minutes, and then say, imagine doing that 24/7 for years and years. How would you feel, and how effective would your services be, or would your uptake of services be? And I think finally, one of the reasons people don't do things is because they're just a wee bit confused about what it is we're actually asking them to do. And I think we need to be absolutely clear, give them things that they can carry around in their heads, that a framework that helps them make their own decisions about what they should be doing with their hands, with their faces, with their gestures, with the words. They need to be able to generate solutions in situ rather than having to go off and read a guideline. So we have to keep it simple, and tell people practically what it is we want them to do. So I hope that's a very long answer, but yeah, perhaps as a profession it would be good for us to start trying to address that in a more constructive way about addressing some of those attitudes, and that's again what the work we're doing is about.
Thank you very much. Okay, I've just got time for one more, if that's okay. Dali, you spoke a little about RCSLT's work, and someone's asked particularly about any research that we're planning, or just expand a bit on what RCSLT itself is going to do.
Okay, well, hopefully everyone's heard of the RCSLT Outcomes Project, which is being rolled out. Phase 2 of this Outcomes Project is to look at the outcomes of work that's outside of the referral process for individuals. So different services and specialisms may call this type of work different things. So we hear it referred to as targeted or universal, or working with an environment or an organisation or a wider community. And really what we need to do is understand what this type of work is, and understand that a lot better to be able to clearly define it, and what it is, what's the purpose of that work, and what is it that we're aiming to achieve by carrying out that work. And once we've defined that work in terms of purpose and aim, then we need to move on to the next stage, which is how we can measure the impact of that. And I think that is a big piece of future research and evaluation for the college.
Thank you. Thank you very much, Della. Okay, I'm afraid that brings us to the end of today's webinar. Thank you all very much for joining and sticking with us. Just to remind you that the presentations, the recording, the transcript will all be online after Christmas, along with a Q&A document. So if we didn't get to your question, we'll do our very best to answer it after the event. I'd like to invite you to join us for our next webinar, which will be on the 17th of January, and the topic will be Developmental Language Disorder. What do the changes mean for your service delivery? So for a section of you, I know that will be a subject of some interest. And in the meanwhile, thank you once again, and could I wish you, on behalf of the Royal College, a very happy Christmas and New Year. Thank you and good afternoon.